Good morning, my name is Catherine, and I will be your attending nurse in the emergency department. May I know what brings you here today? Then the interlocutor may respond you're saying, Nurse, I was bitten by a dog in my hand. Then respond her saying, Sorry to hear that. Try not to be worried at all, you are at the right place. May I know your name for the documentation please? Then the interlocutor may respond you saying, My name is Emma. Then respond her saying, Okay Emma, can you please let me know what exactly happened? Then the interlocutor may respond you saying, I was just walking in the garden today morning. Then a dog attacked me. I think that dog belongs to my neighbor. When I shouted, the dog ran away. Then respond her saying, I am really sorry to hear that. Would you mind if I examine your wound site? Then the interlocutor may agree with that. Then respond her saying, Based on my examination, I can see that the dog bite broke the skin in several places, and one among them is a little deeper. And moreover it's bleeding heavily. Fortunately the wounds are not so deep. Okay Emma, have you done any first aid after the dog bite? Like cleaning the wound and applying some antiseptic cream. Then the interlocutor may respond you saying, Nurse, I was really scared after the incident, however I just cleaned the wound with water. I could not do anything else. Then respond her saying, Okay Emma, good to hear that, you have cleaned the wound site at least. Okay, did you take any painkillers, or any other tablets after the incident? Then the interlocutor may tell you that. Nurse, I have taken one paracetamol to get a relief from the pain. However, it is very painful now. Then respond her saying, Please relax Emma, don't worry, we can start the treatment sooner. So you will be all right. Okay. Then the interlocutor may tell you like, Nurse, how are you going to treat this? Then respond her saying, I understand your concerns Emma, but do not worry, I will explain to you the treatment modalities. First of all I will wash the wound site using saline water, and I can slow the bleeding with a clean cloth. Then I will apply over-the-counter antibiotic cream, then I will wrap the wound in a sterile bandage. Keep the wound bandaged and you can see your doctor. Once your doctor has examined the wound, he will ask you to do your blood test to check if there are any infections, then after checking the result, he may prescribe you the medications, which include antibiotics and pain relief medicines. In addition to that, the doctor may ask you to take an X-ray to ensure that there is no bone fracture, and that tooth fragments are not buried in the wound. Emma, are you following me? Then the interlocutor may agree with that. Then continue by saying, Is it also important to take the tetanus booster now? May I know when you took the tetanus vaccination before? Then the interlocutor may respond you saying, Sorry nurse, unfortunately I don't remember it. No worries Emma, we can take a tetanus booster now. Is that okay with you? Then the interlocutor may tell you like, That's fine nurse, however I understand that there are multiple injuries on my hand. So will there be any stitches required? Then respond her saying, I appreciate your thoughts Emma, however, according to the current medical practice, we do not really recommend any stitches for the wounds from animal bite. Because if we don't do the stitching, the wound will be easier to clean and also there will be less risk of getting the infection. Is that okay Emma? Then the interlocutor may respond you saying, It's really good to hear that, nurse, can you please let me know what are the first aids if someone has bitten by a dog? Then respond her saying, Emma, I am glad to explain you that. The type of first aid you administer will be determined by the severity of the bite. If your skin wasn't broken, wash the area with warm water and soap. You can also apply an antibacterial lotion to the area as a precaution. If the skin is broken, wash the area with soap and warm water, and gently press on the wound to promote a small amount of bleeding. This will help flush out germs. If the bite is already bleeding, apply a clean cloth to the wound and gently press down to stop the flow. Follow up with an application of antibacterial lotion and cover with a sterile bandage. Change the bandage several times a day, and also, all dog bite wounds, even minor ones, should be monitored for signs of infection like redness, swelling, increased pain, and fever until they are completely healed. If the wound gets worse, if you feel pain, or develop a fever, see a doctor immediately. Moreover, dog bites can cause several complications. This includes infections, rabies, nerve or muscle damage, and more. Please understand that tetanus is a serious, potentially life-threatening infection that can be transmitted by an animal or human bite. So a tetanus booster is highly recommended. Are you clear now, Emma? Then the interlocutor may agree with that. Okay, Emma, the doctor will be here in a couple of minutes and examine your current condition and confirm treatment procedures. And also you need to come here again after a few days for a review, is that okay? Then the interlocutor may agree with that. Then wind up the role play.